All right, I think we got it figured out. I think we are figured out. What's up, Chris? Thanks, we got it figured out. We are on it. What's up, guys? I'm Dr. Macalino. Everybody calls me Dr. Mac. Today we're going to be going over the mobility wall. So let's see. I have just a few people on here. So we're just going ahead and jump right into it. A little bit of connection issues, but we're working it out. I think it's because the storm is coming. So the storm is brewing, so we're going to get it figured out here. All right, so I got our mobility wall. This is it. Let me check in here. Okay, so this is our mobility wall. It's actually really, really easy to set up. It just goes on our wall just like this. So we'll get into this door frame. It'll just hook up to a door frame like this. I'm actually going to use the one behind me. I just want to see how easy it is to set this up. This thing is awesome. Shout out to Chris for the hookup. So this just fits right into the door, kind of using it like a screw home mechanism. So we're just right here, and boom, it's here. It's here. So the thing is, this is kind of the next generation of like foam rolling and trigger point therapy and stuff like that. So this ball just comes off just like that, kind of pops off. Like, it's pretty easy. It's good that it doesn't just pop off like that, but it pops off. So we're gonna use that. It's a little bit more pressure. So it's kind of like your traditional like lacrosse ball or something like that. But I want to try to go kind of that head to toe on how to foam roll and stuff like that using this thing. So I'm just gonna hop on here. Boom. Ashlyn's here with Ashley. So we're just gonna get in here. I'm gonna go. I really like using this for like the posterior chain. So if you ever, I think all of our like other therapists and stuff like that probably know anatomy trains. And so I'm gonna just go from like head to toe. Mostly I'm gonna go head to toe because if I get into my feet, I'm kind of a germaphobe. I don't want to stick like the foam roller from my foot up into my neck, but we'll work on it. So if I'm going to start up in here, I'm going to start like from our neck. So if we're up into our neck like this. Boom. Chris actually does an awesome job showing you how to do this, but I do love showing patients like in practice just to kind of how to do this. So I love this because it's so intentional. Oh, so we get the mobility wall. You can really, if you're at home or anything like this, you can just leave this on the wall. You'll use it as like kind of like you have to duck under it and stuff like that. But if I'm here on our neck, we can just really just hang out like this. I'm gonna walk behind here. What's up, Sandy? Here we go. So this is that old school like wooden pillow where you would kind of like release out these suboccipitals right at that hairline. But we talk about like intentionality and purpose all the time in clinic. And so if we're here, we can do so much. Kind of like if we're here, we can kind of get in here in these suboccipitals and do this nod. So we'll nod just like this. I find that one little spot. If it's on my right side, I'll like start to turn into that right side and help out relax some of those suboccipital muscles. Usually I like to hold it for like 15 to 30 seconds. And then we help it relax out. And all to tolerance. So I go into this left side and kind of help out. I'm kind of leaning into this mobility wall. So it's always into these door frames, which is going to be probably the most stable position for that mobility wall to be in. But man, this thing is awesome. Let's see what these guys from Philly, all the way from Philly, LA. What's up, guys? So I'm from Houston. I'm a Houston-based sports chiropractor. All around here, we're all over the Houston area, kind of like in the suburbs. So we're all over the suburbs, in the Woodlands area, if you know where that is, and in Humble, and in the Texas Medical Center, the biggest medical center in the world. So we're just going over the mobility wall. We're going top down. I love the suboccipitals, especially for headaches and stuff like that. Super, super intentional, like I mentioned. Whenever we get this, what, from Houston, Steven? All right. Well, part of Houston, though. Part of Houston. We'll wait for that response as we kind of get into here. But we'll work from, so we just got into the suboccipitals. Next, I'm going to go kind of like into the neck. I think you kind of get the drift with the neck. But one thing probably that I love the most about this are like all the little nooks and crannies of your body that like are really, really hard to get into with a foam roller or a lacrosse ball. And one of these things, which is one of my favorite things, is getting into our like upper trap and levator scapula. It's kind of right in this area. A lot of people have this problem. I think probably like 80% of patients come in here and be Dr. Mac. Dr. Mac got your back, like a chiropractor. So a lot of people get this little area right here that they'll carry stress there. They'll have a lot of these. Yeah, exactly. So if you're able to, what Chris is saying, the ability to like control the pressure with the mobility wall is insane. So it's a lot of upward pressure and inward pressure into the door frame. And so other than that, let me show you how I would usually, before the mobility ball, what I would usually tell patients to do for the upper trap. I would ask them to get like a ball here and have them into the wall and kind of get in here and kind of work out that one area. And that would be, you can go off across Ashley. So can you see how like you're really limited in your range of motion if you're here? So you'd be super, super limited, especially when we're doing like dynamic or active release type techniques. And if with the mobility wall, let me show you, if I'm in here and getting into our upper trap, you could push upwards into it. And so controlling the pressure with our legs and knees and into it like this. And I would push upward and outward like this. So almost like trucking the mobility wall. So if we're here, I have so much range of motion to do whatever I want. And I love this because active release techniques is one of the things that we do in clinic. Is if we apply some pressure here, I can start to turn my head. I can bend it up and down, flexion, and extension. We can turn our head from left to right. We can do all kinds of movements. We can lift our arm up in through the wall like this, really slow and dynamic motions. And I can actually even go into flexion and extension of our arm. So love this thing. There's so many ways to use this. We're going top down here. So we start off with the suboccipitals. We're able to get in there and kind of help loosen up those neck muscles in here. We kind of got into upper trap and that levator scapula, helping relieve some of that pressure. Dynamic movement and being able to assess that pressure for yourself is key, like Chris said. So Chris is a genius, man. He made this thing, and I think I told him it was a gift to the world the way that he did this. So shout out to Chris for that one, man. So just some other key factors for this mobility wall is that like there's plenty of way you can get onto the floor on a regular foam roller just like this. So you can get onto the floor and use like a regular foam roller, but you're really limited in the way that how much pressure that you can put on there. And so it would be a lot of, what's up from Houston? You'd have a lot of pressure going down into it. So you'd only be using gravity unless like you're pushing up against like something else. So let me show you what we can do for our mid back. So a lot of times I would have patients for thoracic mobility, just put it right here and just lay on it. And so a lot of people really need more pressure than that. And so let me show you how. This is pretty awesome. So, and look how easy it is to go up and down. So I'll just loosen it up using these little things. Boom. And we're coming down, so just right here, we'll tighten it up. And so key to this is that a lot of times I would just be having patients just be laying on their back and having that foam roller right there. But if I'm here, I'm using leg drive to push into this thing. So I'll use leg drive, and the key to this is I'm super comfortable. I'm not trying to like hold myself up on my elbows or anything, but I'm right here. And we can do so many different things. So one thing I love to do is cross my arms. I would find that kind of spot in my upper back. And then if it's right here behind my shoulder blade, I can start to turn into it like this. The key to this is like, if I'm on the floor, this is as much motion as I can get because we have the floor here. But if I'm here on my door frame, I can turn in. And if I start to feel it, I can start to kind of play with this motion right here. So I can do all these different things. I can start to turn, I can start to rotate past what's 180 degrees, right? Or 90 degrees. We can go all the way to 180 degrees. We can come here. We can find that one spot. I love this because another thing is that if we feel like some sort of, what's up, Julian? What's up, guys? Oh, yeah. Houston is representing today, baby. But shout out from all the way to California. That's awesome. I love you guys. So I just popped that in. Chris probably hates that. So if I'm right here, if I am like putting this into my shoulder blade and rotating into it, I just put this trigger point attachment into here. And so this thing is amazing. So everybody has done a lacrosse ball technique where they try to just lay on that lacrosse ball. It's uncomfortable. It's, dirty on the floor. It's all these things. But if I'm here on this wall, so there's actually a really cool and easy mechanism for this to like stay put. So this won't turn or anything like that. So this will be right here and I kind of point this out like this. So this ball isn't going anywhere. This ball isn't going to go anywhere. So if I'm here, I can find that one little spot on our mid back and then really hold it. I love this for ischemic compression protocol. So we're going to hold this for about like 30 seconds to 90 seconds. And the key is I'm almost having like no effort. I'm just using leg drive into this wall. And I'm just like this. And the key and the, ischemic compression protocol, you just squish it really, really hard. And then it kind of helps relax out that trigger point. That one's a really, really tough one to get. Even as therapists and stuff like that, we'll get in there all day with our elbow or our fists. And we'll really try to break it down. But if we can do a lot of ischemic compression protocol, just squishing it into this mobility wall. I'm at almost no effort. And I'm pushing into this thing. I'm really getting into it. Again, we can do a lot of like dynamic type movements with that, which would be really, really hard if we had a lacrosse ball doing that thing. Let's see. We got all these people, man. What's up, Julian? Thanks for tuning in, bro. Sandy from Beverly Hills? That's all the way out there. Let's see. We got, let's see. So I'm just going over my notes here. So mid back and stuff like that is amazing for this just because there's so much that we can do on the mobility wall that it's going to be really, really hard to do on a regular foam roller. So I'm going to go into that. Philadelphia, Addison from Philadelphia. Okay. So let's see. We're about to get a lot of rain too. So we're actually preparing for a storm. So pray for us. We're getting in there. So we're actually doing what's going to be really cool is that a lot of my patients have this mobility wall, and so we're able to do like some telehealth type calls and like show them how to do all this stuff, kind of like on a webcam and FaceTime and stuff like that. So if you're having, one of the things is, I told the interns today that having this is really like having or being your own massage therapist, you know, like if you're able to get in there and kind of show them how to do this, it's going to be pretty awesome. It's going to be like either, you know, giving someone a fish or teaching someone how to fish. So it's going to be pretty awesome. Learning from Dr. Mac. Julian, what's up, man? With the little dab. Appreciate you, Dave. We're just trying to, actually, I love the mobility wall because it's such a great like teaching technique. It's such a great teaching tool, especially for patients. Let's see. Chris said, oh yeah, that front. Yeah, so frozen shoulder, it's a huge issue, especially amongst like the aging population and stuff like that. And so the thing that I love about this is that you're able to get through basically through all of those like rotator cuff muscles here and into like your pec and all that for frozen shoulder. And they don't have to bend over and do crazy stuff on the door, just like this. So I used to have them go like this, but for an aging population, for people that like aren't super comfortable on the floor or bending over like that, it gets tough. It gets tough. And so something like this, if you're able to get into the shoulder, standing upright and super comfortable, then it's like an invaluable tool, especially for someone like that. So I'm a sports chiropractor, so I see a lot of athletes. And one of my thing is I treat everybody like an athlete. You know what I mean? So whether you're like a kid just starting sports to like a professional level to, you know, the 70-year-old guy doing like 70 miles on a bike and stuff like that. So it gets pretty crazy. Like how can I use like my skills and my tools to be able to help everybody within that range? And the mobility wall is really one of those things that just the comfort level and like the ease of use. I think that's an invaluable tool for anybody, just because it makes it easy for you to do something that kind of sucks, you know what I mean? So let's see. We got Verona. Let's see the tutorial for this. It's spectacular. For real. This is the new age of foam rolling, man. We're just gonna toss these, man. We're just gonna toss. So other than that, let's see. So I'm trying to go down the whole posterior chain. That's such a huge problem with like everybody because we all sit like this. And so back pain, all that stuff, neck pain are huge things in clinic that we have to go over like on a daily basis. So if we're just making our way down, one of my favorite things to do for our lower back is to get into this muscle right here called the QL, so the quadratus lumborum. It is a really, really tough thing to do. It's a tough muscle to stretch out. It's a tough muscle to get into for a therapist because it's really, really deep in there. The amount of pressure that I would have to get into there is hard for me and it's hard for the patient. And so a really, really awesome way to get into that QL is with the mobility wall. So let me use this trigger point ball right here. And if I'm going to set this up kind of perfect. So I'm kind of at hip level. I would probably want this a little bit higher for somebody else, but for the sake of time here, we're going to keep it right here. So if I'm here, this is all, I'm going to lock this up. Boom. Okay, so this is here. I want this to go right into this low back portion of my lower back. The key to this one, I would have such a huge problem getting on the floor with this. So I would try to stick that lacrosse ball like on the floor, and I would do all this kind of weird stuff. I would try to hold myself up like this. is a huge problem for a lot of people because it's tough for a massage therapist to get into there. I do dry needling. It's kind of hard to needle that area too. So if I'm here, I would stick this right into like the side of my back. I would come into here, and like I said, one of the biggest things for this is the driving motion into the door and upwards into here. So it is kind of tough because it does kind of hurt for me too. But if I'm here, I can move this in so many different ways. My QL, a really great way to stretch this is if I fully, erect my spine and stuff like this. So if I'm here and I'm pushing into the door like this, I can do some ballerina type stuff here. And I would come all the way down. Really, just hanging out on this for a while can relieve so much pressure in that QL and that lower back, especially that lower part of that erector spinae too. And you can kind of just play with it. Really, I love these foam rolling like movement of this foam roller because you can kind of scan your whole lower back. Because if I'm here and I'm kind of pushing into that lower back, I'm like, if I find that one spot, which is like kind of on that right side for me today. So if I'm here and I use these to scan and kind of help relieve some like overall pressure, I would get into this trigger point and I would find that one spot and I would move around. Or I would hold it for a little bit. And then after that gets a little bit too easy, I would start to move around. So if I'm just hanging out and I'm starting to use that pressure of my legs, like leg drive into the mobility wall here, I'm really releasing that thing. And just like that, the comfort of that tool is such a huge plus for me. Because usually I would have them hold it for a while. I would have them hold it for like a minute to 90 seconds. And really that's going to be able to get in there, especially over a long period of time because it's so comfortable. Let's see. Chris is saying, how important is daily self-care in conjunction with the work that you do with your clients or for faster progression? So that is so true. So a lot of times I only spend like 30 minutes to an hour with patients. And, so much of what I have to do is tell people what to do at home. And so having this mobility wall, it really, if we can kind of teach like the overall anatomy of things, then you kind of as a patient or a client, you're able to get in there and do some of this stuff on your own. And so the whole point of this is such a great teaching tool for us as especially therapists. So if you're able to teach someone how to do this for themselves, long-term wise, it saves people time, money. It saves everybody a lot of hurt, especially if you're doing this on a daily basis. I'm big on healthy habits, man, because if we're just an accumulation of our habits, and so it's even that tightness in our lower back, that tightness in our neck and stuff like that, it comes from posture. It comes from our daily activities. It comes from all the things that we do over and over and over again. And so if we can get in there and start to make that one of our habits and that one of our mobility and health habits, then it can definitely help out with especially like some long-term relief type stuff. Let's see. Oh, that's awesome. Yeah. So she said Camille can't comment, but she's watching. Thank you. Thanks for tuning in here. So if we can, we'll get right along moving here. We got into low back and QL. So one of the next things that I kind of want to do, especially for lower back pain, is that glute. So a lot of times if I'm telling someone to stretch their glute out or sit on a lacrosse ball and kind of gets uncomfortable, because I would have them kind of in a extended position for their glute, like a stretch out position for their glute. And if I'm telling them to squish right there, not only is this an uncomfortable position for them on the floor, but it becomes almost way too much pressure for them to put onto their glute, like sitting on a lacrosse ball, right? And so let me show you how we can kind of work around the pressure and start to like personalize that pressure for you. Because if I put this right into here, and really some of like the bigger guys, like the linemen that get on this thing, man, this thing can take a beating for real. So let's see. So if I'm gonna lock this in, but the key is always inward and mostly inward pressure because you're getting so much of the support from this door frame. But if I'm going up into you can definitely go up and into it or down into it. And so let's see. So that's why if I'm doing this foam rolling from my glute, I would kind of have this more pointing outward like this, like at a 45-degree angle, and not like straight down like you would probably like a regular lacrosse ball. So if I'm going to get into this, I can get into my glute max, glute med like this, and if I'm pushing into the wall and upward into the wall, and I would kind of help it stretch out just like this. So if I'm in here, I can, like I said, seek and destroy. So I would kind of find that one spot where I feel super tight. I would hang out on that one spot for about 30 seconds. And if I need a little bit more pressure, I would get onto this trigger point ball right here. So if I'm here, woo, I need to do that, and I'm kind of internally and externally rotating onto that ball. I'm really, really big on like active release techniques, I think, if you can tell, but you can definitely just be doing this like static and you can get so much relief off of it. So from here, in here, it can definitely help out. Let's see. So we're kind of going down this posterior chain. And so a lot of, let's see. Oh, I love that. Our practitioners educate our clients and to build healthy habits. Oh, absolutely, man. Like the thing is, like I'm a gear guy. My whole life I've been a gear guy. And so I'm like, well, what can I get to make my life easier so that I can do what I want to do, right? And so just the ease of use for the mobility wall is insane. Like there's really nothing that is easier to use, more comfortable to use, and just overall, like you can get this for pretty much any body part. And so let me see. And oh, that's awesome. Thanks for tuning in, guys. This is awesome, man. Here we go. So here we go. Let's get into probably my next favorite one to do is, let me unlock this. One of my next favorite things to do is get into that hamstring and groin area, because I was telling Chris this actually when he was showing me. I was like, you know what? You can get a lot of stuff by kind of adapting it to like a lacrosse ball or stuff like that. But like I said, the amount of pressure, like the way that you can gauge the pressure, and being able to like get into like the nicks and crannies that you're not able to get with anything else, and definitely getting into this adductor is one of those things. So let me show you how we do that. So I would have to make this a little bit lower, so kind of right at this mid thigh. And I love this just because you can always personalize this. Not everybody's the same size, obviously. So I'm going to get into here. Right here, I'm going to tighten this up. So make this pretty tight to the wall. This thing is not moving, man. So if I'm going to get into this right adductor right here, I love it when people play with this, because everybody can find something new. You know what I mean? So if I'm here, this adductor, if you can kind of tell, you can kind of see how would you ever get this with the foam roller? You get into like some weird position, like on the floor and stuff like that. Your whole body's on the floor, and in this age, everybody's a germaphobe. You know what I mean? So if I'm able to just stand up and just kind of roll out my adductor and groin and stuff like that. So I'm kind of, like I like to say, search and destroy. So I'm kind of scanning my whole like adductor muscle group. If I'm into here, so if I find it, I'm going to hold it. I can like kind of actively press my leg down into it, like internally rotate and like adduct my leg into the mobility wall. And that's gonna help so much with right here. It becomes a huge thing because so many people, how many people have we heard that like pull their groin, right? And so much of what we have to do is create healthy habits for our muscles. I always say we want muscles to be long and strong. This is definitely one of those, that long part. Long muscle, like a long muscle is a relaxed muscle, the soft muscle. So if we can get in there and kind of help out with that area. I love it for the hamstrings. Let me show you that. So if I'm here, and then I kind of get into this hamstring, it is a little bit crooked. I'm a little OCD, so I'm going to make this really straight. So, yeah, this thing's not going anywhere, right? So, if I'm here, I'm almost like pulling the mobility all towards me, but I'm going right into here, and I can kind of search and destroy this thing too. So if I'm kind of scanning my hamstring, I'll come into here, and if I find that spot, which is right here for me, I'd put it right on this trigger point ball, and I would hold that for a while. Like I said, I like to hold it for like 60 to 90 seconds. And then once that gets too easy for me, I'll get in here, kind of hold it, and then I'll do some movement. So I'm kind of shortening and lengthening my muscle right over that. And that's one of the things that, right? So I always try to like compare this to kind of the old way of how we would do it, right? It's like, how would I do that? How would I get to have movement if I was on a lacrosse ball or a foam roll, right? I mean, I wouldn't unless we were on a chair or something like that. So this kind of takes all the guesswork out of it. And like, if you're on here, it's right here. There's always like new ways. Like, oh yeah, I didn't know I could hit it like that. I didn't know I could like get to that muscle or whatever. So it's pretty awesome. Just playing around with it. I mean, you're just going to come up with all these different things. And one of the things that I love about this too is they have an app that kind of shows you all of these different things. And probably one of the things that amazed me the most about it is that they did it by like sports group. It was like, okay, like golfers have a lot of like rotation and stuff like that. So, you know, we have to release your glute, we have to release your QL and like, you know, get that shoulder rolling and stuff too. So that, I think that's genius. And like, it was like, it really catered to the different like sports groups. And then they did it by condition and stuff like that. So if you, like they say, take the guesswork out of it, man, like this, there's no guessing. So let's see. So we got into this hamstring, got into this adductor, the glute. Man, you can get into your feet with this thing too, but I'm not gonna take my shoes off because Ashlyn's right here. She might smell my feet, so I'm not gonna do that. But you can like have there's so many different ways to be able to do this. One of the other things we're probably just going to now, because I probably need it, is we kind of rolled out like our whole like forearm and stuff like that. So doctors need doctors too. Sometimes you have to be your own patient sometimes. So if we're here and tighten this up, tighten this thing up. And if I'm gonna come into like my forearms, which I do a lot of like manual therapy and stuff like that, I'm always using my hands. If I'm gripping like a tool, like my forearms get super, super tight. And so I would want to be facing inward towards it if I'm going to go like this, if I'm going to kind of like scan it. So we always want to be pushing into the wall, but if I'm here, I'm not pushing too hard, but we can kind of release our whole forearms like this. We can release it like this. And so other than that, we can get into that tricep too. So if I'm here, I'm using this to kind of push into the wall like this. So if I'm here, I can find that one spot. I can kind of put that pressure in here like this. I would find that one spot. I would kind of like, right, scan it. Scan, scan, scan. Wow, that's really tight right here. We're going to push it into the wall like this. And then I would start to move it around, kind of shorten it, and then lengthen my tricep muscle just like that. And do some preacher curls on here, man. Just like this. Boom. While we're here, I'll go ahead and show you like the pec muscle. So a lot of us, going back to what we said about like frozen shoulder and stuff like that, we always want to affect all the muscles that move like that joint. And so our shoulder is the most complex joint in our body. It's the most mobile joint in our body. And there's so many different muscles to be able to do that, that create that range of motion. One of the things that usually a lot of people don't really get into is this pec, because if we can, then we want to be able to make this muscle here long and strong. And one of the ways that we can do that is to release it with mobility wall. Let's see. Actually, I'm gonna switch it. I'm gonna switch it up and make this a little bit higher. Boom. So right at like my chest level here, we'll tighten this up. And again, I'm gonna search and destroy here. So if I'm gonna, sorry, I'm turning away from the camera here, but if I'm gonna find this one spot, like in my chest, so I'll find it. I'm using like inward and upward pressure into my pec. And if I find that one spot, I'm gonna go ahead and move over to this trigger point wall. Get in here and check this out. I love this because we can go internal and external rotation as we apply some trigger point therapy, like trigger point compression to this pec, which is a game changer, man. Because let's say, right, always going back to the old way of doing things, right? Let's say we put a lacrosse ball into a ball like this. Let's say we put the lacrosse ball right here, and we were trying to move it around like this. We're so limited in our range of motion, and so we're not able to get all the way through the full range of motion. And full range of motion is key. Let's see. Oh man. Exactly. So Chris is saying that the tibialis muscle right here, especially this tibialis anterior, it's so easy to get with the mobility wall because, like, you know, how would we be able to do that on our own? Like if we're able to foam roll this or get in the lacrosse ball, we get in all kinds of weird and like plank positions and stuff like that. One of the things that they say is that don't make your recovery like a workout, which is pretty funny because foam rolling for me was like a core workout, you know what I mean? So if we can, we got to be able to get in there and do it really, really easy, you know what I mean? Because it's something that gets a little bit uncomfortable sometimes. And so the easier that you make it, you know, the more that you'll do it, the more that you do it, the more of a healthy habit it becomes. And you become like a more mobile and more comfortable individual here. So if we can, let me show you how we can get into this tibialis muscle, because it's super, super easy. And I love moving this thing up and down, or love showing off how easy it is to take this on and off the door. So here we just loosen it up. Get into here, tighten it up. So we're here. If we want to get into this tibialis, especially this tibialis anterior, so right next to your shin muscle. So for here, we can get into this. I would have this a little bit lower. A little bit lower. Boom. If I'm here, I'm pushing my leg. I can kind of use my opposite leg to drive this into the wall like this. I'm kind of almost just leaning into it. And for a lot of runners, for a lot of like athletes that are sprinting and stuff like that, this muscle becomes super, super tight. So for here, we kind of get into here, right? Search and destroy. So we scan it, find that one spot. Even, especially for this one, the smooth one, right, is a little bit easier, but it, like with these little, we have the, I think the little bit more advanced like foam rolling is because these have little ridges, and you can really actually just stick that muscle into one of those ridges. It's like trigger point therapy in itself, and we're just coming. We can start to dorsiflex and plantar flex our foot. I do like your foot to kind of arc in like this because that's what that tibialis inferior does. So here, boom, 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 boom. We can really, really hold it. I always just say, find it, hold it, and hang out. You know what I mean? Because you like, if you're on the floor doing this, you're really not thinking about anything else except that. But if you can find that one spot, you can make time go by really, really fast just by watching TV. You just want to scroll through your phone or anything like that, because it becomes so just like I'm saying, ease of use. You know, ease of use is a game changer for this thing. So let's see. What can we get into next? Boom. We got. Do you guys have any questions for me or anything like that? I know I just got right into this. Let's see. Timothy. As someone who has wider hips, is there an extra large? Oh man. So actually I've had, let me see. The biggest guy that I had got on this thing that was he was let's see, O-line. He said O-lineman. There's been some really, really big guys on this. So I've had extra large guys on this thing, and so it's held up. The thing is, if you do it right, it's got to be able to go in there and really lock in. You always test it, but that inward pressure of like you being able to control that inward pressure into the wall is key. So, man, if you hit anything the wrong way, it's going to come down. And so, but for this, man, I've had some really, really big guys on there, like over 300 pounds and stuff like that. And so I know you personally, Tim, and you're not 300 pounds, bro. So other than that, if it's always about how to use it. If you're using it right, it's going to do you wonders, man. And the thing is, it's such a great teaching tool, especially for practitioners and providers and therapists. You teach someone how to fish. You teach someone how to take care of themselves. And so one of those things is safety and being able to teach them how to use it safely. And so they do have apps and all that stuff, which is so cool because it takes the guesswork out of everything. And a lot of people who are going to play with it and stuff like that, they'll find ways to kind of make it, but always kind of refer back to how you can use it safely. You know what I mean? But I swear, I told Chris, like, man, I think you could be able to like do pull-ups off this thing. Wouldn't recommend that. But it's definitely sturdy, man. This thing is super sturdy. I think you might have seen it, but I hit my head on this thing earlier, and man, I'm still recovering from it. So sturdy, bro. Let's see. If we're able to, that's the thing. So one of my notes here is that it makes it so easy for you to kind of relax because you're not in weird positions like on the floor. If you're on this like little wooden pillow for your suboccipitals, if you're on this thing for the foam roller, you get into all kinds of weird positions if you're on this thing because you're doing like a core workout. If you're working on your back, you get like headaches if you're like upside down on this thing doing like all kinds of stuff for your neck. So if you can, ease of use for this, key, just takeaways, right? Ease of use is awesome for this. Intentionality behind just like having this thing and having it in your space, being able to be like, use it whenever you need it. You don't need to charge it like a massage gun. You can be your own massage therapist. You don't have to drive to your therapist and be able to be like make an appointment with them and stuff like that. Honestly, a few of the guys that like have it that that I recommended it to, they'll just text me and be like, hey, how can I hit this, this one muscle group and stuff like that. And for me as a provider, I'll just send them the little thing off of like Mobility Wall. I'll be like, oh yeah, this is how you do it. And so it makes it, super, super simple. I was going to say something, the KISS principle, right? Keep it stupid simple. So if we can, man, this thing, it's so easy to use. It's super, super sturdy. You know what I mean? Especially for the extra large hips. For my brother Tim, my brother and best man, Tim Macalino. Appreciate you tuning in, bro. But other than that, man, this thing is awesome. Thanks for tuning in, guys. I have a little bit more time left, maybe like 10 minutes or so. So I'll open it up to questions. If you guys ever want to use this thing, man, I got you. It's yours if you want to use it and stuff too. So I have it like with me in clinic and stuff too. So each of the clinics and stuff like that have one. So if you're ever in the Houston area or anything like that, and you want to check out the Mobility Wall, bro, like we got it in each of the clinics. So just ask, I think the other docs and stuff too have one. So if they're able to do it, man, that's going to be awesome. Steven, you're the man, Dr. Mac. We'll definitely look into getting it. Man, the thing is, I'll get you on it, man. I'll get you on, Steven. I'll get you on the Mobility Wall if you come in the clinic. I'll get you on it. I think you seeing it and feeling it, it's going to change because I don't ever want to get on a regular foam roller now, like it's like when you try the best thing, you don't want to go back. And so if you can, man, just try it. And especially for like all the providers and stuff like that are able to get on this and try it, we're going to have to do it. Elizabeth, I'm going to take it to the hospital. Everybody, that's Elizabeth. She's my wife, my smoking hot wife. She's tuning in, and she's a nurse. So I think all nurses need to do that. Nurse problems, for sure. They need to have mobility walls in every hospital. Let's talk about that. Every hospital, maybe in the Houston area, should have one, like in the break room, right? Like a chiropractor and mobility wall, like in the break room, just being able to like get them moving and stuff. So if we're able to we got to take care of our heroes, man. I told Elizabeth this morning, I said, you're a soldier, you're spec ops, like they're fighting a war. So we gotta, I wore green today because I'm in a war with pain. You know what I mean? So we can, if we can, we definitely got to get this product in as many people's hands as possible, because I think people will move better, they'll feel better, make the world go around. You know what I mean? And so if we can, and more people need to use the mobility wall. I told Chris, man, that it's the gift. It's the gift that he gave the world. You know what I mean? Because I think it's a game changer, a complete game changer. That's a great idea. Oh, teachers. Yeah, teachers need that too. Man, you get the kids on the mobility wall and be able to like get them moving right for the rest of their life, for sure. You got to teach them young. You got to start them young. You know what I mean? Especially athletes, student athletes and stuff. Because how many times we'll tell our kids to like foam roll, right? Who have you ever heard of like a coach or a teacher or a parent even telling like their kid to foam roll, right? So if you show them how to do it, right? If you show them how to do it, they'll remember that forever. Just because, if you're able to kind of show them the right way, hey, they take that with them for the rest of their life, especially athletes, especially people who are going to work at the desk. If they're able to, get up out of their desk on a regular basis and be able to move around, they'll work more productively, they'll feel better, move better, all that stuff. So, man, I appreciate you guys tuning in. Let's see if I missed any comments here. Yeah. So Chris said up here, moving through a 3-dimensional space is key. And amen, man. Amen, brother. Because if we can, if you're getting on a foam roller or you're getting on a lacrosse ball, you really you're so limited in your space. And so being upright and pushing however way that you need to push to, man, it opens up your space so much. And range of motion is huge. Range of motion is key to all of this. So I'm probably gonna wrap things up here, guys. All my Houston people, all you guys all be safe during the storm. I appreciate you guys tuning in. Let's see. I am gonna hit up. Let's see. Philadelphia just went through a storm, so Addison, you guys be safe. Everybody be safe. We're actually closing up clinic today early too because of the storm, man. So everybody be super, super safe. Let's see. Oh, we got a lot of people tuning in from. We were all over today. We were in LA, Beverly Hills. We were in Philly. We were in a lot of Houston. So I appreciate you guys. Yeah. So thanks, guys. Let me see. Let me see if we can wrap this up here. We're doing. Boom. I think we are doing the drawing for that travel bag. So, Chris, if you're still on, Big Chris, or let's see. So other than that, if you guys have any questions, Dr. Matt got your back, man. So let me know. If all you guys who have my Instagram, it's dr.jonathan.macalino, and just hit me up if you guys have any questions. Chris is actually like super, super responsive and stuff like that. So if you want to hit up Chris about whatever is going on with the mobility wall and stuff, he's the inventor and founder of Mobility Wall. So he's just an invaluable resource for anyone looking into move better. He's changed a lot of people's lives too. Yeah, dang, he's already changed mine. So if we can, I'm gonna give Chris a round of applause. And thanks, guys, so much for tuning in. Love y'all. Let's see. Elizabeth, thanks for tuning in. That's my wife. Appreciate you guys. Big Steven tuned in from Houston. Appreciate you, man. Julian, appreciate you from Houston. Oh, that's awesome. Saul from LA, man, that's awesome. Thanks for tuning in, bro. Dave, thanks for tuning in, man. All right, guys, I'm going to end it. You guys be safe. Mahalo.